Welcome to my channel. Please subscribe, click the notification bell, like, comment and share.
Good morning, everybody, or is it afternoon or evening? Good morning. My name is Lola and you're here on my YouTube channel, Vicky's Escapades. Welcome. Nice to have you here again. I'm so excited to have you here. Thank you for your support every now and then. Thank you for always liking my videos, watching, commenting and sharing. May God bless you. Thank you so much. So before much further ado, let's get right into the video.
Please listen attentively to this highly educative topic.
So today we're going to be talking about a very popular topic. Most people know about this topic, and this topic is birth control. Some people will say family planning, but you see, family planning has other aspect of it. So I just want to really talk about birth control today, because birth control is actually, a factor that will help prevent unwanted pregnancies and then create spacing, when we're giving birth, when couples are giving birth to their children and when they're trying to plan their family and all those things. So we have different there are a lot of advantages attached to birth control. So, but then before we dive into the advantages, pardon me if I'm looking this.
So now how we do it. We have to always jot down, and all those things.
So today we're going to be talking about birth control and all those things. So birth control is majorly contraception. The methods of birth control has to do with contraceptive devices, and that is, we have two types. That's the natural and the chemical based method, with particular advantages and disadvantages, and all those things. So let's talk about the methods. We have different methods of birth control. This birth control is really important because it helps even people that are not married, that are having sexual intercourse. It really helps them to prevent getting pregnant and then unwanted pregnancy, because the guy might not want the baby and then trying to abort the baby, and then lots of complications and all those things. So that's what this birth control actually does. So let's get right into the methods. So we have different methods. Like I said before, we have the natural and the chemical based methods. So for the natural method, I think that would be the withdrawal method, the lactational amenorrhea method, that's like breastfeeding. Lactational amenorrhea method is also known as breastfeeding. The basal body temperature, the cervical mucus, what's that again? Have I said withdrawal? I think I've said withdrawal. We have what's other natural method? Then the calendar method. Yes, the calendar method. I think the calendar method is actually the one that is really acceptable that's like fertility awareness method. Is it's a set of practices used to determine all this all these cervical mucus, lactational amenorrhea, cervical mucus, basal body temperature. I think they fall into fertility awareness method, because if you look at the fertility awareness method, are practices used to determine the fertile and infertile phases of a woman's menstrual cycle. So and then I think the natural method should also include the condom usage. That's female and male condom, diaphragm, and all those things. Then I shouldn't forget to mention that there's also the surgical method. That's tubal ligation, and then vasectomy. Vasectomy is for like guys when they cut off the testes and all those things. So vasectomy. So please, I will implore you guys to go back and make your findings, talk to your healthcare practitioner, your healthcare provider, so they can provide more. We have family planning counselors. I'm actually a family planning counselor. Yes, I got my certificate from DKT when I was working at my former place of work. And family planning is so interesting. So before you take any step, ensure you speak to a professional about all these methods available. All these methods have their pros and cons. That's the advantages and disadvantages. So for the chemical based method, which is also known as the hormonal, those ones that can actually affect one's hormonal system, that's we have the birth control pill, we have the implants, we have the injectables. So that's known as Depo, or because DKT produces this lovely amazing injectable, that's Cyana Press. So this one you take it every 3 months, but I'll get right into it. And then we also have I think I've mentioned the IUD, injectable, implant, and contraceptive pills. Yes, those are the 4 major hormonal, that's chemical based methods that we have. So let me get right into it. So I'm going to be starting, I'll take them one by one and just chip in quickly their disadvantages and advantages. So I'm going to be starting with the birth control pill. The pregnancy rate for birth control pill ranges from 0.1% to 5% with effective use. So this birth control pill, there is this one that you take that ideally women ought to take like every day. You take it daily, same time, like daily and consistently. You take it, maybe if you're taking it by 9 o'clock today, 9 a.m, you keep taking it 9 a.m daily, because if the way how constantly you take it will determine how effective it is, but it's really effective. And then we have this emergency contraceptive pill, that's Postinor or post pill. So this post pill is the one DKT people make. So this Postinor is the one you take after having unprepared sexual intercourse, sexual intercourse that you didn't prepare for, so you quickly just take Postinor or post pill. And the thing about Postinor, there are lots of side effects. This emergency contraceptive pill and the birth control pill itself, the side effects are headache, nausea, vomiting. Sometimes you even feel like, are you sure I'm not pregnant? Spotting or bleeding in between menstrual cycle, irregular menstrual cycle, different things, different things. So that's about the birth control pill. So we'll go to the implant. The implant actually is the one that is always inserted around this side, like this side of your arm. So this implant, the pregnancy rate actually increases from 0.2% in the first year to 0.5% in the third year. So that's for implants. So the implants is involves a minor surgical intervention. That's because they'll have to clean, then cut incise, like cut hair to put the object in. So once they put the object in, implant is majorly always for, like, it lasts for 2 to 3 years and all those things. And mind you, let me quickly chip this in. Birth control pill and emergency contraceptive pill, they do not prevent you from having sexual transmitted infections. So don't think they will prevent you from having those things. No, they don't. And then also implants too, they don't. So implants have similar side effects with they have similar side effects with birth control because they are highly hormonal and all those things. So they can disrupt your menstrual cycle, cause headache, nausea, vomiting, mood swing, all those things. So, and then we now have the transdermal patch. So this transdermal patch is only given with prescription. You can't get it without prescription. So it contains a week supply of hormones. So you take it so this transdermal patch, you apply it maybe on your thigh, your vagina lining, or your buttocks. So you apply it for 3 weeks. That's every week. So on the 4th week, that's when your menstruation is expected to come. So you do not apply it then. So you just apply it. So it gives one a weak dose of hormones. So these hormones prevent you from actually getting pregnant. Do you understand? So, and then the side effects will be skin irritation, because it's a patch. So when taking it off, it can actually cause irritation to the skin, and it may come off without you knowing, like maybe while you're in the shower and then you're taking your bath, it can just come off. So these are the things you have to always check when you're putting on a transdermal patch. And then the next thing is the vaginal ring. The vaginal ring is almost like a transdermal patch, but that one is always left in the vagina. Like the ring is always inside the vagina, so it's not like the patch that you can just put on your thighs, your buttocks. That one's always inside vagina, and that one too also produces a weak dose of hormone. So you use it for 3 weeks, and then the 4th week, when you ought to see your menses, you do not use it. So that's how that one is. And then I think I spoke a bit about the synthetic hormone injections. So that's Depo. So Depo is actually the chemical name is Depo progesterone acetate. Depo progesterone acetate. So but the trade name is Depo. So if you want to get it, just say you want to get Depo. So for this one, the failure rate is always approximately 0.3% during first year, and all those things. So your weight, like, and other medications you're on do not affect this Depo. You can be on other medications and still take Depo. So that's that. So I told you for the Cyana press, because I was trained by DKT, so then I was usually giving people DKT products and all those things. So then I was giving the Cyana press. So for the Cyana press, you take it every 3 months. And the beautiful thing about DKT products is once you take the Cyana press this month now, you send a code to a number. So before, like maybe 2 days to your day of your day for the next dose, they will like send you a message as a reminder, oh, it's time for you to go for your next dose of injection. So this one too is hormonal. So anything hormonal can either do this or do that. Can toy with you, cause mood changes, irritation, like and then can disrupt your menstrual cycle and all those things. So that's that for the synthetic hormone injections. So next we go to the intrauterine devices. So for these intrauterine devices, we have the copper T and then we have the hormonal. So for the copper T is not like, so we have the copper and the hormonal. So it's a T-shaped that is usually slid into your vagina, and then it takes a longer year, but although it is not as cost effective as others, this one is more expensive than the birth control pill, the injections and all those things. So this one is between 5 to 10 years. It can last between 5 to 10 years, but you can remove it anytime you deem fit. You can decide to remove it maybe after 2 years. And then there's always this once you insert it, there's always like a very tiny like thread that would be showing at around your vulva area, like although it doesn't disrupt you from having sexual intercourse, that thread is there, so it will be easy to like bring out the copper T or the other IUD device, the hormonal one, anytime you want to like bring it out, maybe when you're tired of it. So that one, the IUD, actually the major thing I know IUD does is major side effects is it can lead to infection, to be honest. Like lots of women have complained about infection and all those things, and ectopic pregnancy is a very serious complication. If pregnancy occurs while the IUD is still in place, the risk of miscarriage, the risk of miscarrying that baby is 50%. But once you notice that you're pregnant and you quickly remove the IUD immediately, so the risk drops down to 25%. So these are the things we should always like put into consideration when we are doing all these things.
We have come to the end of the first part of this video. Watch out for the second part of this video soon. Thanks for watching this video. Please like and comment on it. And don't forget to click the subscribe button.
Watch out for part 2. Watch out for part 2.